and I am a prevention specialist here at Wellness Point. And today we'll be talking about marijuana, the use, the effects of marijuana, and some of the things that the health issues that comes from smoking marijuana. What is marijuana? Marijuana is a plant, dried leaf plant. Okay, what marijuana causes? Short-term memory loss, reduction in ability to concentrate, depression, fatigue, anxiety, distorted perception, loss of motor skills, trouble thinking and problem solving, and dizziness. These are some of the things that marijuana could cause. Signs that a person is using marijuana: bloodshot eyes, clothes and you smell like marijuana. Isolation. Teens are usually isolated from their friends and others and their parents when they're smoking marijuana. Depression. A state of depression comes from smoking marijuana. And anxiety. Your anxiety is high. If you already have anxiety issues, they would worsen with smoking marijuana. Decline in school performance. If you're in school and your grades is okay, they'll go from okay to totally failing when smoking marijuana. A lot of kids believe that smoking marijuana would not affect their grades or their school performance, but it does. A lot of children or kids feel like smoking marijuana has no bad effect from smoking it. They say that smoking marijuana is it's a dried leaf and it's nothing harmful in it. It is harmful. It can cause some of all of these things that we talked about: depression, isolation, and fatigue. So smoking marijuana is not a smart thing to do. Health effects and risk: cancer, lung problems, immune system. If your immune system is already low, smoking marijuana would have you not healing as fast as you usually would if you heal pretty quick. And it could cause you to have heart problems. All of these things and health risks from smoking marijuana. Here's some pictures on how to identify some marijuana plants all over the world and country. So what are we going to do? We're going to think twice before trying marijuana. A lot of times peers and older siblings will offer you marijuana to tell you just try it, there's nothing wrong with it. It is something wrong with it. Smoking marijuana leads to change in the brain similar to those caused by use of cocaine and heroin. Mentions of marijuana use in emergency room visits have risen 176% since 1994, surpassing those of heroin. The British Lung Foundation reports that smoking 3 or 4 marijuana joints is as bad for you and your lungs as smoking 20 tobacco cigarettes. That's a lot. Contrary to popular belief, marijuana use is not a rite of passage. It is a risky behavior with serious consequences. These are facts and myths. You can't get addicted to marijuana. That's a myth. Facts. Each year, more kids enter treatment with a primary diagnosis of marijuana dependence than for all other illicit drugs combined. 60% of teens currently in drug treatment have a primary marijuana diagnosis. Those are truths. Myths. There are no long-term consequences to marijuana. That is truly a myth. There are long-term consequences. Research shows that kids who smoke marijuana engage in risky behavior, risky unprotected sex, and other different risky measures um, that teenagers take. Having sex, getting into trouble with the law, or losing scholarship monies. Marijuana can also hurt academic achievement and put kids at risk for depression and anxiety. A lot of colleges, if you accept a scholarship and you can get into those colleges, they may drug test you for marijuana, which would cause you to lose that scholarship for those. Myths. Marijuana makes you mellow. That is truly a myth. Marijuana may seem to make you mellow, but it doesn't. Facts. Research shows that kids who use marijuana weekly are nearly 4 times more likely to engage in violent behavior. So today we talked about marijuana, some of the effects, some of the signs, some of the use, and we also showed some of the identification of marijuana. And thank you.